Hemangiomas are very interesting. I remember the first time I came across a hemangioma. One day I was in my office and a lady walked in with her child. The child had a massive hemangioma. It was almost about the size of her head. The mother looked at me and said to me, "Look at her, she's dying. Are you going to send her home to die like the rest of your colleagues?" She said, "I've been all over the world. No one will touch her." Of course, I was a young doctor, and I wasn't going to say that, but I didn't know what the hell to do. So I said, "You know what, come back tomorrow. I've got to study the scans and think about this." And that night I looked at all the scans, and I kind of imagined a way around this. And I brought the child in, and I began to operate, and miraculously I found that there was a tissue plane around this hemangioma. In other words, if you imagine something expanding, as it expands, it compresses the tissue around it. And if you get into that layer of tissue, it's almost bloodless. So I found this capsule and I was able to shell it out. The hemangioma came out, and miraculously, child came out of cardiac failure. Today she's married with children, probably judging from my age, she probably has grandchildren already. And that was the first time I realized that hemangiomas do have something of a capsule. It's a false capsule, but if you get into this plane, you can take them out safely and without much blood loss. These are very rare conditions. Most physicians will not see anything like this in a lifetime. This is all I do. I see lots of very, very difficult, very dangerous, very challenging cases, but there is a lot of hope. There is much that we can do, and we're progressing. We're getting better and better.